If you are on Medicare or approaching Medicare age, there is one number you absolutely need to understand in 2026: $2,100. That number is extremely important because it represents the annual out-of-pocket threshold for covered Part D prescription drugs in 2026. But before you hear that number and assume Medicare has placed a $2,100 limit on everything you might spend on healthcare this year, stop right there. That is not what the $2,100 figure means, and this distinction could make a huge difference to your retirement budget. The $2,100 amount applies specifically to covered prescription drug costs under Medicare Part D. It does not mean your total Medicare healthcare expenses for the entire year are limited to $2,100. You can still have Medicare premiums, you can still have costs for doctor visits and medical services, you can still have costs associated with Medicare Advantage. You may have supplemental insurance premiums, you may have other healthcare expenses that are outside the Part D prescription drug benefit. So if you are planning your retirement budget around the idea that Medicare will never cost you more than $2,100 in a year, that assumption could be seriously misleading. The important question is not simply, what is the Medicare limit in 2026? The better question is, which Medicare expenses does this limit actually apply to, and how could the 2026 rules affect my personal budget? That is what we are going to break down. Because Medicare in 2026 looks very different from the Medicare system many retirees remember from years ago. If you have been enrolled in Medicare for several years, you may still be thinking about prescription drug coverage using the old coverage gap system. But the Part D benefit has changed. The coverage gap, commonly known as the donut hole, was eliminated beginning in 2025, and the redesigned structure continues into 2026. That means understanding the current system is much more important than relying on what you remember from 5 or 10 years ago. Let's start with the $2,100 number. Under the 2026 Medicare Part D structure, once your out-of-pocket spending for covered Part D drugs reaches the applicable annual threshold of $2,100, you enter catastrophic coverage. At that point, for covered Part D drugs, you generally pay no cost sharing for the rest of the calendar year. That sounds simple, but there are several important details hidden inside that sentence. First, we are talking about covered Part D drugs. Second, we are talking about your applicable out-of-pocket spending under the Medicare drug benefit. And third, reaching that threshold does not erase every other Medicare expense you may have. Think about it this way. Imagine you have several prescriptions that you take throughout the year. Your plan has a deductible. After that deductible, you move into the initial coverage phase. During that phase, you generally pay a portion of the cost of covered drugs while the plan pays the rest, depending on the details of your coverage. As your qualifying out-of-pocket drug spending accumulates during the year, you get closer to the $2,100 threshold. Once you reach that threshold, you move into catastrophic coverage. And for covered Part D drugs, your cost sharing is generally zero for the remainder of that calendar year. That is a major change for people who remember the old Medicare prescription drug system. For years, retirees had to understand the coverage gap and the different stages of Part D. The redesigned benefit is much easier to understand in one sense because the old coverage gap has been removed. But it also creates a new situation where retirees need to pay close attention to how their individual plan works. Now let's talk about another important number: $615. That is the maximum Part D deductible for 2026. No Medicare Part D plan may have a deductible greater than $615 in 2026. However, that does not mean every Medicare drug plan charges a $615 deductible. Some plans have lower deductibles. Some plans may have no deductible at all. So don't automatically assume that because $615 is the maximum, you will personally have to pay $615. Your actual deductible depends on your plan. This is one of the most important lessons when comparing Medicare plans. National Medicare numbers tell you what is possible under the rules. Your individual plan determines what you actually experience, and that difference matters. Suppose you see two Medicare drug plans. Plan A has a lower monthly premium. Plan B has a slightly higher monthly premium. At first glance, Plan A may look like the better deal, but then you enter the medications you actually take. You discover that your medications are placed on different formulary tiers. Maybe Plan A charges significantly more for one of your important prescriptions. Maybe Plan B has better coverage for that medication. Maybe Plan B also gives you access to a preferred pharmacy where your cost is lower. Suddenly, the plan with the higher monthly premium could potentially cost you less overall. This is why retirees should never choose a Medicare prescription plan simply by looking at the monthly premium. The premium is only one piece of the puzzle. Your prescriptions matter. Your deductible matters. Your drug tiers matter. Your pharmacy matters. Your coverage rules matter. And your expected healthcare needs matter. Now let's look at how the redesigned Part D structure works. After any applicable deductible, you generally move into the initial coverage phase. In that phase, the standard structure generally requires the enrollee to pay 25% of covered drug costs until the annual out-of-pocket threshold is reached. But again, don't assume that every plan will look exactly the same in every detail. Medicare drug plans can have different premiums, formularies, pharmacy networks, and other plan-specific features. That is why the official information for your specific plan is so important. The biggest mistake you can make is hearing a national Medicare number and assuming it automatically tells you what your personal bill will be. It doesn't. Your personal situation determines the actual result. Now let's talk about one of the biggest developments affecting prescription drugs in 2026. Medicare's negotiated prices for the first 10 selected prescription drugs took effect on January 1st, 2026. This is a major development in the Medicare prescription drug program. For the first time, Medicare negotiated prices for those selected drugs became part of the system. That sounds like it should mean everyone taking one of those medications will automatically pay the same amount. But that's not necessarily how it works. Your actual out-of-pocket cost can still depend on your Medicare plan, the drugs coverage under your plan, the pharmacy you use, the stage of coverage you are in, and other factors. So if you take one of the selected medications, don't simply search for the national negotiated price and assume that number is your personal cost. Instead, look at your plan information. Check how the medication is covered, check the applicable pharmacy options, and check your expected out-of-pocket costs. This is especially important for retirees who take multiple medications, because even a difference of several dollars per prescription can add up over an entire year. And when you are living on a fixed retirement income, small recurring expenses can become significant. Now there is another 2026 feature that many people may not fully understand. It is called the Medicare Prescription Payment Plan. This option can allow certain Part D enrollees to spread their covered prescription drug out-of-pocket costs across the calendar year rather than paying large amounts at the pharmacy all at once. For someone who has a large prescription expense early in the year, this can make budgeting easier. Imagine someone who has an expensive prescription in January. Without a payment plan, that person might have to deal with a large bill relatively early in the year. With the payment plan, eligible costs can instead be spread across monthly payments during the year. That can improve cash flow. But there is an important point to understand. The payment plan does not make the underlying medication cheaper. It changes when you pay. That distinction is extremely important. If your prescription costs $1,200 during the year, spreading the payments over several months doesn't magically turn $1,200 into $500. You are changing the timing of your payments, not eliminating the underlying cost. So the payment plan may be useful for someone who struggles with large bills at certain times of the year, but it may not provide much practical benefit for someone whose prescription costs are already low and predictable. This is why Medicare decisions are not just about annual costs. They are also about cash flow. A retiree can technically afford an expense over 12 months, but still struggle if a large bill arrives all at once. Managing cash flow can be just as important as knowing your annual total. Now let's talk about insulin. Insulin has received significant attention under Medicare, and the 2026 rules continue to make cost sharing an important issue for beneficiaries who use covered insulin products. For covered insulin products, Medicare has a monthly cost sharing cap. CMS says that beginning in 2026, the applicable amount is the lesser of $35, 25% of the maximum fair price established under the Medicare Drug Price Negotiation Program, or 25% of the negotiated price under the applicable plan. That sounds complicated. And honestly, it is. The key point for a Medicare beneficiary is that you should not assume every insulin product, plan, and situation will work exactly the same way. Your specific coverage matters. If you use insulin, review the details of your plan and understand exactly what you are expected to pay. Don't rely only on a headline that says insulin is capped at a certain amount. The details of the covered product and your plan still matter. Now let's talk about vaccines. Another benefit that continues under Medicare is no cost sharing for certain adult vaccines recommended by the Advisory Committee on Immunization Practices and covered under Part D. This is another example of why Medicare beneficiaries should understand what their specific plan covers. Preventive care can sometimes save money not only by reducing direct healthcare costs, but also by helping people avoid complications later. And when you're planning a retirement budget, preventive benefits are worth paying attention to. Now let's move to one of the most important things you can do in 2026. Review your Medicare prescription drug coverage. Don't assume that the plan you had last year is automatically the best plan for this year. Medicare plans can change, premiums can change, deductibles can change, drug formularies can change, pharmacy arrangements can change, your prescriptions can change, and your health needs can change. Even if your plan worked perfectly for you last year, that does not guarantee that it will be the best choice this year. This is especially important for people who take several medications. Start by making a complete list of everything you take. Write down the exact medication name, write down the dosage, write down how frequently you take it, and make sure the information is current. Then compare those medications against your plan's formulary. Don't simply look at whether your medication is technically covered. Look at the tier, look at the estimated cost, look at any applicable restrictions, and look at the pharmacies available under your plan. A medication being covered does not necessarily mean it will be inexpensive. Two plans can both cover the same medication while charging very different amounts. This is why personalized comparison matters. Now, let's talk about pharmacies. Where you fill your prescription can make a difference. Some plans have preferred pharmacies, some have standard pharmacies, some offer mail order options. The cost of a prescription can vary depending on the pharmacy and the plan's arrangements. So if you've been going to the same pharmacy for years, don't assume it is automatically the cheapest option under your current Medicare plan. Check. You may discover that another participating pharmacy offers a lower cost. Or your plan may offer a mail order option that makes sense for medications you take regularly. But again, convenience matters too. The cheapest option on paper isn't always the easiest option for every person. If a pharmacy is far away, difficult to reach, or doesn't fit your schedule, you need to consider that as well. The goal isn't simply to find the lowest possible price. The goal is to find coverage that works for your medications, your budget, and your life. Now let's talk about extra help. This is something that many Medicare beneficiaries should understand because qualifying individuals can receive substantial assistance with prescription drug costs. Medicare's Extra Help program is designed to help eligible people with Medicare prescription drug costs. For 2026, Medicare says people receiving extra help can have a $0 plan premium and $0 deductible, along with limited copayments for covered prescriptions depending on the medication. If you qualify, this can make a major difference. And one of the biggest mistakes is assuming that you won't qualify without checking. If prescription costs are putting pressure on your retirement budget, investigate whether you may be eligible for assistance. Don't be embarrassed about seeking help. Medicare programs exist because healthcare costs can put serious pressure on household budgets. The money you save on prescriptions can potentially be used for other important expenses, including housing, food, utilities, or emergency savings. Now let's return to the $2,100 number, because this is where many people can get confused. The $2,100 figure is important, but it is not a universal Medicare out-of-pocket maximum. You need to understand the difference between Part D prescription drug costs and other Medicare healthcare costs. For example, you could reach your Part D out-of-pocket threshold and enter catastrophic coverage for covered prescription drugs. That does not necessarily mean you have no other healthcare expenses. You could still have premiums. You could still have expenses related to medical services. You could still have costs under Medicare Advantage depending on your plan. You could still have supplemental coverage costs. And you could still have healthcare expenses that Medicare does not cover. So when you're building your retirement budget, don't write down $2,100 and assume that is your annual Medicare budget. That could leave you seriously underestimating your expenses. Instead, think of Medicare as several different pieces. Think about your premiums. Think about prescription drug costs. Think about doctor and hospital services. Think about dental, vision, and hearing expenses that may not be fully covered under original Medicare. Think about supplemental coverage if you have it. And think about the possibility of healthcare needs changing as you get older. This is especially important because healthcare spending can be unpredictable. You may have a year where your medical costs are relatively low. Then you may have a year where you need more care. A strong retirement plan should leave room for that possibility. Now let's talk about a common mistake retirees make when reviewing Medicare. They focus almost entirely on the monthly premium. A plan with a low premium can feel attractive. You may think, why would I pay more every month if I don't have to? But the monthly premium is not the same thing as your total annual cost. Suppose Plan A costs $20 less per month. Over 12 months, that's $240 in premium savings. That sounds good. But suppose one of your important prescriptions costs $40 more every month under Plan A. Now you're paying an additional $480 per year for that medication. Your $240 premium savings has disappeared, and you may actually be spending more overall. That's why you need to look at the complete picture. Premium plus deductible plus expected prescription costs plus other applicable expenses. That's a much better way to evaluate coverage. Another mistake is waiting until you need a medication to understand your coverage. Don't wait. Review your plan before you have a major prescription need. Know where your medications fall. Know which pharmacies participate. Know what your expected costs are. And understand how the coverage stages work. Knowledge is especially valuable when you're dealing with healthcare because decisions made under pressure can be harder. Now consider another situation. What if your prescriptions change during the year? This is one reason Medicare planning cannot be a one-time event. Maybe your doctor changes one medication. Maybe you start another. Maybe a medication becomes available in a different form. Maybe your dosage changes. Your expected annual prescription costs can change along with it. So stay aware of your coverage throughout the year. You don't necessarily need to obsess over your Medicare plan every week, but you should understand what you're paying and why. Look at your statements. Look at your pharmacy receipts. Check whether the charges make sense. And if something looks confusing, ask your plan or Medicare for clarification. Don't simply assume that an unexpected charge is correct. At the same time, don't assume that every unexpected charge is an error. Medicare prescription drug billing can be complicated, and there may be legitimate reasons for changes in your cost. The important thing is to understand what happened. Now let's think about Medicare as part of retirement planning. When people prepare for retirement, they often focus on three major categories: housing, food, and everyday living expenses. Healthcare sometimes gets pushed into the background. That's a mistake. Healthcare can become one of the largest expenses during retirement. And prescription drugs can be a significant part of that cost for people who take multiple medications. That's why the Medicare rules for 2026 deserve attention. The $2,100 Part D threshold is important. The $615 maximum deductible is important. The elimination of the old coverage gap is important. The Medicare negotiated prices for the first selected drugs are important. The Medicare prescription payment plan is important. The insulin cost-sharing rules are important. Extra help is important. But none of these numbers should be viewed in isolation. Your plan is what ultimately determines how these rules affect you. Your medications matter, your health needs matter, your income and budget matter, and the pharmacy you use can matter. So if you're approaching Medicare age, don't wait until the last minute to learn how the system works. Start learning before you need it. If you're already on Medicare, don't assume you understand everything simply because you've had coverage for years. The program changes, the plans change, and your own situation changes. One of the smartest things you can do is keep a simple Medicare folder or digital file where you keep your plan, information, medication list, important notices, and questions you want to ask. That way, when something changes, you have the information in one place. And when you're comparing plans, you aren't trying to remember everything from memory. Now let's revisit the biggest misconception one final time. The $2,100 figure does not mean Medicare guarantees that you're toe.